Hello everyone. So we will continue the previous topic. We have discussed starting with a new subject, that is medical surgical nursing 1. In that the first and foremost core topic, that is health assessment. In that health assessment we have discussed health history, right? So what are all the criteria and what is the purpose, what are all the barriers we have discussed, right? So health history is over. What is the biographic and the complete format we have discussed, right? So we'll continue with the health assessment second part, that is nothing but a physical examination, right? So in that physical examination, again, what are all the techniques, what is the purpose, these all things we will discuss now. The second foremost thing in a health assessment is nothing but a physical examination, right? So we will discuss now in this lecture about a main thing, that is physical examination, right? Yes, in this physical examination, yes, what is the main aim or main objective? If you think main objective of this physical examination is nothing but, we'll see, to collect a valid information. Yes, to collect a valid information means, that means accurate information. As I have told you in the health history part, if you collect the health history in an accurate manner, the treatment will be accurate. Likewise, furtherly, there will be accurate medication, treatment will be there, and there will be 100% outcome will be there. Yes, that is nothing but to collect a valid information from the client. Okay, then next, to identify the problem. So identifying problem is nothing but to discover, that means to recognize the problem, what is the major problem the client is having. Yes, so to detect the problem or to diagnose the issue, what is the health illness regarding the client. Yes. Then next, nursing interventions, to frame the nursing interventions. So after all assessing part is completed. Yes, so once you have assessed the client, then next you will frame a goal. Yes, then next you will planning and implementation part is nothing but nursing intervention, right? So nursing intervention is nothing but once the doctor's orders has been given to you. Yes, once the doctor has given you the written or oral orders, so what you will do, you will plan your nursing care, right? So nursing interventions will be implemented. So accurate nursing interventions have to be planned. Yes, based on the clinical manifestations of the client. Okay, then next, evaluation. After the nursing interventions, what you will do? Evaluation. Yes, whether the condition has subsided or not. So for your nursing intervention, that means before and after nursing intervention. So the condition of the client before the nursing intervention and condition of the client after the nursing intervention, that is nothing but a evaluation. So here within the assessment part, you will notice that particular signs and symptoms, particular clinical manifestations are there for a client. But in the evaluation part, if you find the same manifestations there, is your nursing intervention is worked out there? No. That means you need to improve you need to upgrade your interventions, right? Nursing interventions. The nursing care plan which you have given is not up to the mark. Yes, so the evaluation part is also that necessary. So whether your care plan has worked out or not, yes, there is a better outcome or not, yes, whether the disease has got subsided or not, yes, these are all things are major important ones. So those are all nothing but certain aims and goals, right? Then next, yes, skills needed for the physical examination. So physical examination is it skills are needed here? So definitely yes. So why? Because as I have told you in the health history part, without with a haphazard knowledge, if a nurse or if a doctor or a physician if they perform physical examination with a haphazard knowledge or nil knowledge, what happens? They won't be in a condition to understand the situation. They can't evaluate the situation. They can't diagnose the situation. So here there will be haphazard outcome. Yes, evaluation will be not up to the mark. Yes, definitely there will be obstacles, right? So we will see what are all the skills needed for a physical examination for a nurse or for a doctor, whoever it may be, who performs physical examination. Okay, so first and foremost thing is the healthcare personnel must be medically fit. Yes, medically fit in the sense he should not be with any communicable diseases, right? He should maintain medical fitness, right? So that is nothing but a medical fitness. That means his health should be normal without any spread of communicable diseases to the clients, right? See, if at all, for example, a nurse is having a common cold, what happens? In spite of wearing a mask and all everything, there will be, to some extent, there will be spread of infection, right? So make sure that nurse or a doctor, whoever it may be, who performs physical examination, that means who are getting in contact with the client, must be medically fit. Yes, that means they should be away from diseases, right? Then next, thoroughness in the sense, so say for example in a physical examination for abdominal examination, a nurse is performing a examination. Yes, so she doesn't know what are all the quadrants, how to examine the abdomen. Yes, she's having a haphazard knowledge. Yes, once she had a demonstration, that's it. That knowledge is not necessary for her, right? So practice, she has to maintain that thoroughness, right? So with that thoroughness in a particular examination or particular work, then healthcare personnel can do effectively. That work can be done effectively. Yes, thoroughness in performing physical examination is necessary, definitely. Okay, then next, accurate technique. Yes, accurate technique in the sense, so how to perform, what are all the body techniques we need to keep, and what are all the sites we need to identify within a particular body, and those all must be accurate. Yes, say for example, if you think you are performing abdominal examination, generally abdomen is divided into 4 quadrants, and upper quadrant and lower quadrant. Yes, so in that manner, dividing the abdomen into 4 quadrants, the physical examination is done, right? So if at all there is no basic knowledge regarding this, something about a particular content, we cannot effectively perform the physical examination. Not only a physical examination, if I say any work, if you consider thorough knowledge and accuracy and proper grip on that particular topic is definitely necessary. Yes, then that time you can easily perform. Yes, your mind might be in somewhere, but your actions will be definitely worked out when you are perfect and when you are thorough. So here, why every patient in a society, what happens? So generally every people likes to visit only the experienced doctors, not to clinics. Why? Because they are experienced ones, so then they are thorough with their particular subject or particular department. Yes, say for example cardiology. Yes, heart surgeons. Yes, so cardiac surgeons, Yes, most people like to visit only experienced doctors. Why? Because they are thorough in a particular department and particular content, right? So they can be able to diagnose and treat the people in an effective manner. So that's the reason most of the people like to visit, like to go to only experienced doctors or physicians. Yes, that is a major important thing. So yes, that is nothing but an accurate technique. Then next one, definitely knowledge. Yes, see for example, a student nurse, for example, she doesn't know how to perform physical examination. She just saw a doctor performing like a physical examination. Okay, she just once she saw the physical examination and just she started to perform on her own. That means she tried to written demo herself, and she is perfect for the second time. So that means practice makes man perfect, right? So that is nothing but a grasping power. Yes, if at all, if you doesn't know the technique, so you need to have grasping power. So nothing, if you have, you can't persist, you can't exist there. Yes, so like when you are performing a physical examination, grasping skills, knowledge and accuracy, these are all very important, right? Then next, yes, concentration. Yes, so we'll see. So concentration here, it is nothing but, so when you are doing a physical examination, when a doctor is performing a physical examination, he just got a call and he just picked up and he's talking, and with the other hand he is doing a physical examination. So the concentration, the matter which is communicating between the phone call and himself is very, very interesting there. So he just concentrated on the phone call, not on the physical examination. He just, after ending up his call, so what happened, he just diagnosed that something like under evaluation, he just diagnosed. Why? If at all, if he didn't attend the call, he might have he might have diagnosed the client in an accurate manner. Yes, so concentration is very important. Presence of your concentration is very important, right? So not only your actions, your mind and your thoughts must be here, there present, and physical examination must be done with the concentration also. Okay, yes, that's the thing. And objectivity is nothing but with a specific goal. Why you need to do physical examination? Why? If you get a question, so why? So in the previous slide we have discussed that there is a goal and certain goals and aims, so to perform physical examination, right? That is nothing but objectivity. Objectivity is nothing but with a certain purpose, with a certain goal, or with a specific objective, you need to perform a certain work. That is nothing but here physical examination. Okay, that means why? To evaluate the client's condition. Yes, to evaluate the client's condition and to treat the client in an accurate manner, you are performing physical examination. That's it, right? That is nothing but an objectivity. Yes. Then next, yes, so yes, objectives, if you want to see, to define yes, physical assessment as, yes, physical assessment is nothing but so it is an assessment part where a client's conditions can be ruled out and he can be treated with accurate medications. Yes, that is nothing but a physical examination. Yes, describe 4 techniques used in the physical assessment. Yes, so here in physical assessment, again there are 4 techniques. We'll discuss in the next slides. To know how to do a head to foot, head to toe assessment. Yes, this is also very important, which we discussed in the health history part, right? In a general examination, right? So head to toe examination, I'll just discuss in detail how to examine each and every part from head to toe in the next slides. Okay, yes, we'll see. Yes, techniques of physical examination. First one, it is inspection, palpation, percussion and auscultation. Okay, inspection, palpation, percussion and auscultation. These are all 4 techniques which you use in the physical examination. Okay, then next.